Welcome to Authentic Moments with Kiva. In this episode of Authentic Moments, I am fortunate enough to speak with three of Cone Health's nurses. At Cone Health, when we think about advancing the work of diversity, equity, and inclusion, it really brings me to a point that I just can't wait until one day that we can all just be respected and accepted for who we are. And so we're going to talk today about providing care for the LGBTQ community and how we do that in a way that the trust is built and the respect is there and it offers them the opportunity to have the best care that they can have, right? Just like everybody else. And so, like I said, I'm joined today with three of Cone Health nurses, Melissa, Yancey, and Bree. And so thank you all for joining me today and being open to the conversation. And we always want to stay in a learning zone. And so that's what this is about. And we want to make sure that we're all being open to learning new things and understanding the world around us, right? So I'm going to start off with asking you all if you could please introduce yourself so people can get to know you a little bit better.
I'm Melissa Wilkins. I've been with the Cone system for 30 years, just starting my 30th. And I'm one of the kind of odd people of my generation. I have stayed in the same job the whole time. I've been on the same unit, and it's really my only job I've ever had.
Wow.
I went to UNCG. That's what brought me to Greensboro. As far as like what drove me to be a nurse, I was telling Nancy when I was a kid, I had two options. I wanted to be either an artist or a nurse, and I cannot draw. So, hence, I am a nurse. And when I went to UNCG for my obstetrics and labor and delivery little seminar, whatever you call it, semester, I fell in love with my instructor. She was the most wonderful thing that ever happened to labor and delivery, and that's why I do labor and delivery. Her name's Martha Eats. She worked for Cone forever and worked for UNCG as a professor, and so many of my peers feel the same way. We all really love her, and that's what drove us to do labor and delivery.
My name is Brianna Price. I am a newer nurse. I have about a little shy of 2 years experience. I am with these two lovely ladies on labor and delivery at Cone, the Women and Children Center. And I had a simultaneous job where I also worked in the birth center setting while doing Cone Health hospital setting. So my love has always been pregnancy and birth. And that is the exact reason that I became a nurse when I went to, ever since I was a wee little tot, I would watch a TV program called Birthday with my mom. We would cuddle up on the couch and we would watch this TV show that would come on, I think on Saturdays. And I watched that since I was 6 years old. And so I knew my earliest memories was that's no doubt, that's 100% what I'm going to do. And so I originally went to college, and I thought that the only way to be able to do that was to be an OBGYN. So I went the pre-med route. I became a doula. I started sitting in birth spaces and seeing what all the options were. And then I learned about what a midwife was. And that was my that was the point in my life where I had to reevaluate everything, because I was on the pre-med track, and then I realized that midwifery was more where my heart was.
Awesome. Well, thank you all for the great introduction. And so, Yancy, I have to pull off of this because you said you love building the bond, right, with people and your patients. And so let's talk a little bit about that and building that bond with patients that are LGBTQ patients, right? And when you say building a bond, you mean building a bond with all of the patients that come into your into your space, right? And that you have the pleasure of serving.
Mhm.
So we received a letter. You all received a letter, and I got my hands on it. And I was just so thrilled with the great experience, the exceptional experience that that family received as they were having their baby. And I know I called you all and we chatted about it, and I was just grateful that they felt that they were taken care of in that way to make sure that they let us know that and let your leadership know that, and they shared it, and we shared it with Cone Health, right? So I want to talk and dig a little bit into that. And so, can you talk a little bit, Yancey, and then we'll go over to Melissa and Bree about what was that experience like for you?
It was a very special experience for me, and one experience that I'm going to remember for my whole nursing career. It was my first experience that I have like taking care of somebody that was genderqueer, and I really enjoyed learning the process of how they identify. And I know that when I give patients care, I want them to feel respected and accepted in the environment that I want to give them, like in their birth experience. So making sure that this patient and their family felt that acceptance and just a supported space was very important to me. And to read the letter that they sent, showing and saying that they felt that acceptance was very, very special.
Yeah. So you all are on the front lines, and it's very crucial that you all build that relationship with patients, right? And so when you talk about learning, how does the learning process happen so that you can take care of all patients? Like, Melissa, talk a little bit about that, and how do we do that, right? Because I know me, and I'm gonna make a mistake. It's just gonna happen, and I just, you know what I mean. But we want to be able to know, what do I do with that, right?
Okay.
Or how do I learn? So can you talk a little
The
bit?
first thing that was amazing is that family actually did kind of like a birth plan. They sent a letter to the hospital saying, this might be new to a lot of people, but this is our family, and these are things that we would like, and it would make our experience better.
Okay.
And the letter was amazing, and it really kind of laid out expectations and how things are going to go. A great person told me one time, when a person is coming out, you've essentially known this for the better part of your life. You've felt this way your whole life. You just haven't told anybody.
Mm-hmm.
The day that you tell somebody, we can use my parents as an example. The day
Okay.
that I told them that I'm gay, that's the day that they begin. I've had my life, but they have day one until what's coming. So that's where you have to give people a little bit of a little relaxation to know that everyone's going to make mistakes. You know, my
Yeah.
family said some things that were hurtful, but you have to know that they're going to try. It's going to take time, and they need that time just like you had that time.
Mm-hmm.
So I really appreciated this family because there were times when the physician or myself, we said something that maybe the wrong pronoun. And then
Okay.
we just stopped for a second and said, I'm really sorry.
Mm-hmm.
It's new and I'm trying. And the physician said, I'm older and I'm gonna make mistakes, but I'm trying and I want you to have the best birth experience you can have. And so
Awesome.
and I don't believe that education should start with that family. You shouldn't go into a room and ask
Okay.
people who are trying to have the best day of their lives, hey, can you tell me what I'm supposed to do? That
Right.
education should start beforehand so that you feel comfortable and you can make their birth experience exactly what that's about. It's not about a teaching moment. It's about
Right.
those people for that day. And
That's right.
and gay people and genderqueer people, everybody, they're not having a gay birth experience. They're having a baby. That's what
That's
that
right.
should be about. And
That's
so I
right.
was really proud of our hospital. Across every unit, people were really excited and really just wanted to make it that a really great birth experience.
That's awesome. So let me ask you, and maybe Bree, you can chime in on this, because when you say, okay, they had a birth plan, right? But not everybody does that. And so how important is it for patients to let you know how they identify, right? And does that impact their care in any way? Like, why do they need to tell us that if we're gonna treat everybody with respect and acceptance anyway? What difference does that make?
That is such a good question. And I'm going to hit a couple of things that come with that. First, the importance. So a birth plan period, whether you are queer or you have any specific requests, a birth plan is a tool in order to show that you are going to be an active member of your own care. And it can facilitate conversations, it can facilitate perspectives, it can just facilitate it can facilitate an environment where you feel heard and you feel seen, and it gives you a platform to get on the same page as all of your care providers.
Okay.
So that being said, the way that this one family wrote that letter that integrated some of their plan, spoke about their pronouns, it spoke about a little bit about their past, it spoke about their perspectives, their boundaries, and then other requests that they had, so that people could sit on that, they could stew on it, and then come to their birth space as prepared, as physically possible. So having that discussion, even in our admission questions, it says one little box that talks about sexuality, and then it also talks about gender identity, and those are two completely separate things.
That's
so
right.
to have those conversations show, like, okay, I present feminine, so most people who aren't immersed in the like LGBT environment and know all the intricacies of sex and gender would assume that I'm a woman. And if I have a partner who presents masculine, we'll assume that that person is a male. And so it's those assumptions that can be dangerous. So facilitating those conversations, you can never assume someone's sex, you can never assume someone's gender, and you can never assume someone's sexuality. So having those conversations, like maybe I'm a gender queer a gender queer birther, and this is my trans partner. And so it's just all about coming to your birth space and already having someone know you, and not having to create, so that you can have that environment of trust, because it's all about trust. So facilitating those conversations around, this is who I am, and not only do I want you to be nice to me, because that's a bare minimum, I want you to embrace me and be on my team. It's all about having people have your back and be on your team. So only being able to have an environment where you can be very open and genuine about those parts of yourself can you create a relationship with your care providers where you feel like they have your back. And that's what it's all about. And so that's why having those conversations are not only important, but they are absolutely vital. So like for me, my partner walks through the world and identifies as a woman. And so if we walk into a birth space, I personally wouldn't want people to see, oh, well, that person looks like a girl and that person looks like a girl, so they're lesbians.
Okay.
That's a very basic way of looking at things. That's just an assumption. You have to have a conversation with me to see, like, well, maybe I'm pansexual or bisexual, so that you know who I am as a holistic person. So the way that one family did that was very, very helpful, because it facilitated some conversations we could have before about, all right, well, I don't have a lot of training with this, so let's have some conversations. So the root of all of these issues can just be remedied by just a conversation, just like what we're having right now.
Yes. Awesome. So this is a question, and I think about this because you all have talked about, hey, you need to educate yourself, right? And because once you're in that moment and you're in the hospital, and then to try to learn at that point, about how to interact or what to say or what not to say. It's a
Oh,
little bit disrespectful, right? It's
right.
almost like, yeah, no, I'm not gonna. So, so let's talk about what would be helpful, right? What have you all found helpful in the way of training or things that could help, that could be a help to other caregivers? And what does that need to look like? So, what has helped you in this way? Nancy, I'll throw this one to you too.
So with this particular experience, I made sure to read their birth plan in the letter that they sent to the unit before they even came in. And it was very important for me because, like I said, this was my first experience taking care of this genderqueer person in their birth experience. So it was very important for me to really research pronouns and more about that community. So I just kind of did some research of myself, just researching on the computer and stuff like that, but also like digging deep down into like my values. And I just wanted to make sure that I was going to be able to be that person that could support this patient and their family and make them feel accepted. And I think that's very important to touch base with like your values and beliefs before caring for patients. And after I did that, I realized that this would be an amazing experience for myself, and it's something that I feel like I was going to be able to do for them.
And actually knowing your own biases.
Absolutely.
Everybody has something in their life that they're going to draw from, and if you know ahead of time what might be sensitive to you, that can help. One thing you said that was great was you said, how can education really be progressive? And there's the Columbia School of Nursing in New York is offering a certificate to its nurse practitioner students. And what that whole thing is, I mean, it's a class, and they actually have clinicals for that class. And they're teaching nurse practitioners the right way to do an assessment, the questions to ask, things to be mindful of. And so I think things like that are absolutely amazing.
Absolutely. And it's more, and it's out there too, right? And you just got to look for it and take advantage of those opportunities. I think that what you all both talked about around biases as well as doing your deep work, right? And I think a lot of times we shy away from that, right? Because we don't want to dig deep into ourselves and think about that. But it's about awareness. It's about that self-awareness. And so if I understand what my biases are, then I can really start to learn how to mitigate them, right? And let it not interfere.
I have a couple of resources who have just have like completely changed my life. And so I started off with just like basic books. You could just start basic books about anti-racism, basic books from queer people talking about the queer experience. And that's a really good starting point for your own personal work, just to kind of get you comfortable with the terms, because there is a lot of anxiety that comes into, all right, if we're going to sit and talk about queerness, or we're going to sit and talk about the Black experience in America, there is some anxiety behind, I don't want to say something terrible. So doing that like personal work a little bit to get your like, maybe I shouldn't say this down, and then go into spaces where those people are giving trainings. So personally, Instagram has been the most amazing resource for me. I've taken classes with like trans doulas in the community who talk about local birth experiences, both being a birther themselves and also serving primarily queer birthing families. And then right now I'm in a class right now called Birthing Beyond the Binary, which I just found on Instagram, and it's ran by a Black trans birth worker. And so not only are you putting money in toward like supporting these causes by giving money to specific people who are trying to educate others, but you also sit in this space, build a community to where you can have these conversations, you can mess up, you can very lovingly be corrected, you can hold each other accountable and create this culture of accountability.
Well, thank you all for that, because I think that it's very, very important that we provide people with the tools, right? And the give them what they need, but they need to go do it, a lot of the work on them for themselves, right? Because as Bree said, when we're talking about anti-racism, right? Read up on it. You know what I mean? Go and learn about it, and learn how you can contribute to making sure that we're building that community that we want, right? So I want to talk just a little bit about healthcare outcomes a little bit. And if a person decides that they do not want to come out, that's not what they're not ready to do that. Are there any implications to the health the care that they get because they decided not to come out?
I don't think so. I think we generally give the same care we try to give the same
Yeah.
care to everyone. If they're not open and out, I don't think that's a reflection. That's their,
Yep.
that's happens on their time frame. That's when they want to share that with whoever they want to share that with.
Yeah. Okay.
If you look at the studies around this topic, it kind of goes back a little bit more. So a lot of like Black birthing people, other groups of color, and queer people, there's already a perspective that a lot of hospital care is going to be unsafe. And so within like even pre-pregnancy, like birth, statistically, it's shown that that they go to other environments outside of the hospital setting because they don't trust the care that they're going to get. So whether they're out or not, that's why people tend to go to out of hospital births for those populations. And so whether that, I think that even out of hospital care can be miraculous care in the right situation with the right providers, but it does affect outcomes in the sense that that safety is not there, that trust is not there, and so it can lead them to other places.
What Bree was just talking about, I was speaking mainly for myself, which is probably the wrong thing to do. I feel like gay people kind of have it easy. Where it becomes a huge problem is trans people. 31% of trans people don't have regular access to health care. Yeah. And 22% say they avoid going because of fear of discrimination. Mm-hmm. And that's a huge problem. When I wrote something down, like Jancy and I were writing notes, and I wrote, I'm getting older. Things are great for me. I mean, back in the day, I never would have told anybody. And then I came out on my unit. I made it a little easier for some people on my unit just to come out and be like, hey, most of the people in this unit are inclusive. And that's great. But then 2 days ago, Arkansas passed a bill that's banning gender affirming care to trans youth. I mean, this is 2 days ago.
Wow.
It's 2 days ago. And governors in 3 states right now, Arkansas, Mississippi, and Tennessee, signed trans athlete bans. And then I found this, which is absolutely crazy. Right now, on the state level, there are currently 108 bills targeting LGBTQI community. 108 anti-gay bills. And it's just, you think, I like to live in this utopia where I think things are getting better, and it's the same thing, and it's the same thing with racism. I'm thinking, oh yeah, everything's getting better. No, it's just pushed under a rug and nobody says anything about it. It's always been
right. Yep, that's right. And it makes you kind of think, right? People, we've been fighting for the freedom, right, for a really, really long time, right? And it's like, my goodness, are we, when is that day going to come, right? When is that day going to come? So that kind of brings up another point, and Bree, you talked about it a little bit. So you know how we talk about LGBTQ friendly, like when they have the stickers and so talk to me a little bit about that. Like, what have you heard about that? Or does that really make a difference if you're labeled as LGBT friendly, and what does that look like?
Personally, I think it's like anything else. If you want to label yourself, you can label yourself, but what does that mean? So like someone can wake up one day and say, yeah, sure, I'm a doula, but did you do the training? Did you get like credentialed it. So don't let it just be a title. You can say, yeah, I'm anti-racist, but are you doing anti-racist work within yourself? So that little LGBTQ friendly is a great sticker. That's fantastic. Right. But it goes to show like what depth of that is within the organization. So whenever you get hired onto a position, is evaluating your own bias a part of the training? Is access to discussions and trainings led by people living that experience accessible and free? So you get to see an organization's priority and perspective by how they train their people, and then the continuing education that's available. So are these, organizations supplying free or very, very cheap, intense classes where you evaluate not only your own unit and your own work, but how that affects every single different person who could walk through your doors? So to me, to be a true LGBTQ friendly area means a whole lot of things, because to be LGBTQ, you also have to be very, very intersectional with it, because queerness is a term that just means, against the status quo, which just because you're LGBTQ does not mean that you're white. It does not mean that you are not, it doesn't mean that you're from America. So it means that you have to have a true intersectionality to your training and the continuous training of your docs, of your nurses, of your techs, of your midwives, of every single person who talks or touches any person who could walk through that door.
Bree, you're so right. You said a thing that just it kind of hit home with me too. So you said anybody that touches that patient. So yeah, we got the birth plan for this family. We read about it. It went to the nursing departments. It went to the department heads, and we thought that it was going to touch every person that was going to see that patient. But what if the patient comes in to the front desk?
Yeah,
they use the wrong pronouns. They don't know. They have no way. They don't get that education.
Yeah. Or a phlebotomist who comes in and does an IV and says, "Hey, mama, how you doing? Congratulations." So that's why training all the way across every single level is vital.
Absolutely. So we got some work to do, right? So we got to make sure that we are providing that level of training for everyone. And that every employee needs to be able to be trained on that. I absolutely agree with you. And so, we'll be calling on you all to help us put that curriculum together.
I've got some stuff to send you.
Okay, yes, send it my way, please. I really appreciate your time today and all of the wisdom and honesty that you all have shared here. I do want to leave with one thing, and that is I would like for you all to provide at least one piece of advice that you could give to your colleagues, your other frontline, bedside nurses, phlebotomists, anyone at Cone Health. What is one piece of advice that you would give them as they prepare to care for the LGBTQ community?
Never stop learning. You're never at the point where you're safe or that you know it all or that you're knowledgeable. You could be a professor in women and gender studies, doctorate level, and your work is never, 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 never done. And as we have more generations who are smarter than the previous generation and keep us accountable, like the younger kids for me are blowing things out of the world, like blowing things out of the water, and are consistently keeping me accountable. So as more people come up with different ways of living and different needs, continuously keep learning and keep fighting to make the world safer for everybody. And that's a personal journey. So just never stop.
Yeah, Bree, actually, that's exactly what I was going to say. Learning, just keeping yourself in the learning environment and learning about yourself is a big thing too. I think that was my biggest thing is, like we were talking about, learning your biases and trying to work towards those and just making yourself better.
I kind of feel like it's definitely, and I'm going to put myself a little bit in that category, it's the older people who aren't willing to change, and they've been kind of stuck in this way of living and don't want to learn anything new. So you have people who, when somebody uses a pronoun they, are really confused by that. And it's not hard at all. I mean, there's so many things on the internet, what not to say, terminology. It's so easy in a matter of 10 minutes to look up something and say, well, gosh, I say this a lot and it's terribly offensive. I think I'm going to stop saying that. So, I mean, with that, education becomes some personal accountability where, yeah, just look up, ask a friend, is this offensive to you?
Yeah.
Because it's very easy for someone to just say, yeah, that kind of, it's hurtful. And once that's done, you learn something new and keep moving on.
That's right. That's right. So, I mean, I've learned a lot, and you have to be willing to seek the knowledge, right? And then you have to be willing to apply it. I think Bree said it earlier about avoiding assumptions, and just that's big, and we do that a lot. And so we have to stop and think and slow down and think about what we're doing, because we never we have to think about what implications that could be, for the other person. So the advice that you all have given is phenomenal. Stay in the learning zone and always be curious about the world around you, right? And hold yourself accountable and start to have conversations that you wouldn't normally have, or ask questions that you would normally ask, because that's how we're all going to learn and be able to have that world that we all wish for one day, where everybody can be accepted for who they are.